Good evening, folks. I've got discussion C for you. We're discussing organ donation for the night for C. But we're discussing the other side of organ donation where people are on the donation list but don't quite make getting one. So we're discussing the fact that they pass away before they can get an organ transplanted. So here we go. Here's a concise summary of the key points from the article titled "Someone Will Die Today Waiting for a or a donor organ" by Victoria Cook, BBC London. Organ donation crisis in the UK. Over 12,000 people have died nationally in the past decade while waiting for organ donation transplants. In London alone, more than 800 deaths occurred during that time. Currently, 8,000 people across the UK are on transplant waiting lists. Legal framework and public action. The UK now operates under an opt-out system, meaning organ donation is presumed unless individuals explicitly opt out. Despite this, signing the organ donor register is still strongly encouraged to clarify intentions and ease decision making for families. In 2023, 173 families overruled their loved ones' registered wishes to donate. Urgent call to action. NHS blood and transplant emphasis that more people are likely to need a transplant than to become donors. Director Anthony Clarkson warns someone will die today waiting for an organ transplant. If you're thinking about how this intersects with your work, culturally responsive health interventions, there's a rich opportunity here to explore how donation awareness campaigns could be tailored for marginalized communities, especially where mistrust or cultural beliefs may influence donor registration. Want to co-design a myth-busting outreach framework around this? Here's a snapshot of the most recent organ donation statistics, primarily from the US and global resources. United States organ donation stats. 103,223 people are currently on the national transplant waiting list for the US, guys. Okay. 13 people die each day waiting for an organ transplant. A new person is added to the waiting list every 8 minutes. In 2024, over 48,000 transplants were performed. Every donor can save up to 8 lives and enhance 75 more. As of late 2024, 106,868 total candidates needed a life-saving transplant. 60,078 were actively waiting. Over 17,000 deceased donors contributed organs. More than 7,000 living donor transplants occurred, mostly kidneys. Global highlights. In 2022, there were approximately 157,494 sold organ transplants worldwide. Kidney transplants make up 65% of all organ transplants globally. Spain led the world in deceased organ donors per million population. 49,038 donors per million. In the UK, 2022 to 2023, donors aged 18 to 49 represented the largest group at 36%. Colombia ranked highest in public willingness to donate organs, posthumously, with 75% expressing consent. If you are thinking about how to integrate these stats into outreach or toolkits, toolkit development, we could build a comprehensive dashboard or myth-busting infograph tailored to different cultural contexts. Want to sketch out what that could look like? Organ donation has seen both encouraging growth and persistent challenges over the past few decades. Here's a breakdown of key trends. Long-term growth in transplants. Steady increase in total transplants. In the US, the number of organ transplants has risen annually over a decade, with 2024 marking the 14th consecutive record-breaking year. Deceased donors have grown significantly. Over 17,000 deceased donors contributed organs in 2024 alone. Living donation is also expanding. More than 7,000 living donor transplants occurred in 2024, mostly kidneys, but liver segment donations are rising too. Shifts in donor demographics. Older donors are increasingly accepted due to improved screening and surgical techniques. Diverse communities remain underrepresented in donor registration, despite targeted outreach efforts. Policy and system changes. Many countries, including the UK and parts of the US, have adopted or debated opt-out systems to increase donor rates. The Organ Procurement and Transplantation Network, Optin, and UNOS have enhanced data transparency and equity matrix. Persistent challenges. Waiting lists remain long. Over 106,000 people in the US still need a life-saving transplant. Daily deaths. About 13 people die each day waiting for an organ. Family overrides. Even with registered consent, families sometimes block donation, seen in recent UK data. Would you like to co-design a dashboard or infographic that visualizes these trends across time and geographically? We could tailor it to highlight disparities, cultural barriers, or policy impacts. Whatever best supports your outreach and toolkit work. Here's a fresh snapshot of recent organ donation statistics in the United States based on 2024 data from organdonation.gov and UNOS. National transplant waiting lists. $103,223 people are currently waiting for a life-saving organ transplant. A new person is added to the list every 8 minutes. 13 people die each day waiting for an organ. Transplants performed in 2024. Over 48,000 transplants were completed. 17,000 deceased donors contributed organs. More than 7,000 living donor transplants occurred, mostly kidneys, but liver segment donations are increasing. Donor impact. One donor can save up to 8 lives and enhance 75 more. Despite growth, 60,078 people remain actively waiting for transplants. These numbers reflect both progress and urgency. If you're thinking about how to integrate this into outreach or culturally responsive toolkits, we could build a visual dashboard or myth-busting resource tailored to specific communities. Want to sketch that out, what it could look like? Absolutely. Organ donation awareness campaigns have a measurable and multifaceted impact, especially when they're culturally responsive and community driven. Here's a breakdown of their effects. Boost in donor registrations. Campaigns like DoNation campaign in the US led to 23,104 new donor registrations in just 1 year. 2023-2024 with over 662,500 people registered since its inception. These efforts directly increase the pool of available organs, improving transplant rates and saving lives. Myth busting and education. Many people avoid registering due to misconceptions, e.g., fears about premature death, declarations, or religious prohibitions. Awareness campaigns dispel these myths through trusted messengers like healthcare professionals and faith-based and faith leaders. Targeted media and grassroots outreach help shift public perception and normalize donation. Cultural sensitivity and equity. Campaigns that encourage ethnic minorities and marginalized communities using culturally tailored messaging see better outreach or outcomes in donor registration and trust. In countries with diverse populations, such as the UK and US, this approach is vital to closing equity gaps in organ access. System level improvements. Awareness efforts often go hand in hand with policy shifts, like moving from opting in to opting out systems. They also support uh, transport efficiency, ensuring organs reach recipients faster and remain viable. Long-term behavioral changes. While short-term spikes in registration are common, sustained campaigns foster donation-friendly cultures in workplaces, schools, and communities. These environments encourage ongoing conversations about end of life planning and altruism. If you're thinking about adapting these insights into toolkit or outreach strategy, we could co-design a modular campaign framework complete with myth busting scripts, culturally adapted visuals, and evaluation matrix. Want to sketch out what that might look like for rural aging communities or faith-based networks? Organ donation awareness campaigns face a complex web of challenges, some deeply cultural, others systematic. Here's a breakdown of the most pressing barriers. Misinformation and myths. Many people believe doctors won't try as hard to save registered donors, or that donation disfigures the body. Both false. In India, for example, some families fear organs won't reach the right person or that donation dishonors the deceased. These myths persist across cultures and often go unchallenged due to taboos around death. Cultural and religious hesitations. Beliefs about bodily integrity, reincarnation, or spiritual purity can discourage donation. Campaigns often struggle to engage communities without culturally tailored messaging or trusted messengers. Infrastructure gaps. Even when families consent, logistical hurdles arise. Lack of ICU beds or trained staff to identify brain death. Limited transplant centers equipped for cardiac donation. Poor transplant systems. Some regions lack green corridors, or air ambulances. Low registration rates. In India, only 1.4 of the population is registered as donors. Mortality communities in the US also show lower registration rates due to mistrust and lack of outreach. Emotional timing. Families are often asked to make the donation decisions during moments of profound grief. Without prior conversations or clear documentation, many decline even if the deceased was willing. Ethical and legal complexities. Definition of death. Brain death versus cardiac death vary across jurisdictions. Allocation, fairness, and transparency remain contentious, especially in regions with limited oversight. If you're thinking about how to tackle these barriers in your own work, we could co-design a participatory campaign framework complete with myth-busting modules, culturally adaptive scripts, and infrastructure advocacy guides. Want to sketch out a toolkit for rural or faith-based communities next? Organ donation awareness campaigns face a complex web of challenges, some deeply cultural, others systematic. Here's a breakdown of the most common pressing barriers. Misinformation and myths. Many people believe doctors won't try as hard to save registered donors, or that donation disfigures the body, both false. In India, for example, some families fear organs won't reach the right person, or that donation dishonors the deceased. These myths persist across cultures and often go unchallenged due to taboos around death. Cultural and religious hesitations, beliefs about bodily integrity, reincarnation, or spiritual purity can discourage donation. Okay, guys, so that is it for shows for now. I'll be back on later with more shows. For now, Gator Wellness. Take care, folks.